I was recently granted the opportunity to work with a patient with fibromyalgia. I decided to brush up my knowledge on it by doing my special needs presentation on fibromyalgia. FMS, short for Fibromyalgia Syndrome, is widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. FMS is believed to amplify pain sensations by affecting the way your brain processes pain signals. FMS can result in severe disability and loss of function, leading to decreased quality of life. More than 5 million Americans over the age of 18 have been diagnosed. Most are women. Men and children can be diagnosed, and most people are diagnosed during middle age. My patient is a 38-year-old African American female diagnosed with fibromyalgia 10 years ago. She experiences her chronic pain at night and takes Norco for pain relief. It's fairly controlled with exercise and diet, although she does have clicking and popping in her jaw and she's sensitive to weather changes. At night, she notices that she grinds and experiences dry mouth. During her exam, she presented with moderate chronic periodontitis with 5 to 6 millimeter pocket depths and clinical attachment loss. She has multiple missing teeth. Pathophysiology. Cerebrospinal fluid substance P is a neurotransmitter released when axons are stimulated. Consistency elevated in people with FMS. This causes increased sensitivity and enhanced awareness of pain. Substance P is involved in transmission of pain information from the periphery to the central nervous system. Research has also linked abnormal levels of the neurotransmitters serotonin, norepinephrine, and dopamine with FMS. Symptoms of FMS. Widespread pain is described as constant dull ache that has lasted for at least 3 months. People with FMS often awaken tired although they've slept a long time. Sleep is often disrupted by pain. Cognitive difficulties being a symptom referred to as fibrofog that impairs the ability to focus, pay attention, and concentrate on mental tasks. Doctors don't know what causes fibromyalgia, but it most likely involves a variety of factors working together. These may include, but are not limited to, genetics, infections, or physical and emotional trauma. There may be certain genetic mutations that may make you more susceptible to developing this disorder. Some illnesses appear to trigger or aggravate fibromyalgia. Post traumatic stress disorder has been linked to fibromyalgia as well. Risk factors include sex, family history, and rheumatic diseases. Women are diagnosed with fibromyalgia more often than men. You're susceptible if a relative has the disease. And if you have had rheumatoid arthritis or lupus, you're also at risk for developing fibromyalgia. The pain and lack of sleep associated with fibromyalgia can interfere with your ability to function at home or on the job. The frustration of dealing with an often misunderstood condition also can result in depression and health related anxiety. A fibromyalgia diagnosis can be made if a person has had widespread pain for more than 3 months, with no underlying medical condition that could cause the pain. While there is no lab test to confirm a diagnosis of fibromyalgia, your doctor may want to rule out other conditions by completing a complete blood count, erythrocyte sedimentation rate, or thyroid function test. In general, treatment for FMS includes both medication and self care. No one treatment works for all symptoms. Medications can help reduce the pain of fibromyalgia and improve sleep. Pain relievers include over the counter prescription pain, and narcotics are not advised because there's a risk for dependency and the pain may worsen over time. Talking with a counselor can help strengthen your belief in your abilities and teach you strategies for dealing with stressful situations and avoid depression. A few lifestyle and home remedies to help FMS be more manageable is to reduce stress, get enough sleep, exercise regularly, pace yourself, and maintain a healthy lifestyle. Proper nutrition can help your body stay healthy and provide a constant supply of good energy. A couple recommendations may be to eat fruits and vegetables, Drink plenty of water. Eat more plants than meat. Reduce your intake of sugar. Get regular exercise as best as you can and lose weight or maintain a healthy weight. Oral concerns include facial pain, limited mouth opening, muscle and joint pain during opening and closing, xerostomia, causing increased caries rate, periodontal disease, mouth ulcers, and candidiasis. During the appointment, you want to document the date of diagnosis, course of the syndrome, all medications, and if she or he is experiencing any pain. Refer the patient for further evaluation if you deem it necessary. During the treatment, you want to prevent oral infection, ensure patient comfort, make sure there's a stress-free treatment environment, and have nitrous oxide on hand if necessary. When educating your patient, you want to encourage the patients to live a healthy lifestyle, work around their dexterity issues with power toothbrushes, flossing devices, or interdental brushes. Talk about depression and encourage and be compassionate and provide encouragement. You want to educate on the difference between chronic FMS pain and acute pain from an oral disease such as an abscess causing jaw pain. I would like to introduce you all to the tray do away. This tray contains a mouth guard infused with the key ingredients to fight periodontal disease and combat dry mouth, along with preventing the urge to grind. There isn't a cure for fibromyalgia. Instead, treatment focuses on reducing your symptoms and improving your quality of life. This is often accomplished through the use of medications, self-care strategies, and lifestyle changes. Thank you all for listening, and I hope you enjoy learning about fibromyalgia syndrome as much as I did. Have a good day.